Hi, my name is Ghazwan Acash. I'm the Director of Pulmonary and Critical Care Services at St. Joseph Hospital in Nashua. Today we are talking about sepsis, and by definition, sepsis is an overwhelming body response to an infection that we already have. It triggers the immune system of the patient to respond, and it causes a host of signs and symptoms. It is considered to be a medical emergency that needs to be recognized and treated in an urgent manner to save the patient's life. So the signs and symptoms of sepsis basically start with any infection. It can initially start as a little bit of fever, not feeling well, fatigue, cough, but then it develops and the patient becomes less responsive, the heart rate becomes very fast, extreme weakness because of low blood pressure, and those signs are alarming and they should trigger the patient to seek medical attention. So sepsis is usually diagnosed based on a host of symptoms and signs that we spoke about. The patient will have fever, his heart rate will be fast, we call it tachycardia, breathing fast, we call it tachypnea. Depending on the source of the infection that triggered sepsis, say for example, if the patient has pneumonia, then you would expect him to have shortness of breath, cough, chest discomfort. If the source of infection is urinary tract infection, they will have flank pain, frequency in urination, burning sensation when they go to the bathroom. If the source of infection in the skin, redness of the skin, irritation, the skin will feel hot. If this is central nervous system infection, then change in mental status, seizures also can be seen. People are at risk of sepsis are basically those who have problem with their immune system, like patients treated for cancer, patients who have diabetes, patients who have other medical problems like heart failure, COPD. Their immune system is weaker than normal, and they are definitely at higher risk of developing sepsis. Another category is the elderly person. Somebody who is above the age of 70 is definitely have higher risk of developing sepsis as well. Causes of sepsis are basically most common is bacteria, the one that we know that cause sometimes pneumonia, urinary tract infection, skin infection, but also viruses can cause sepsis. We've seen cases of sepsis and septic shock due to regular influenza or COVID-19 infection and RSV. In immunocompromised adults, fungal infection also can cause severe sepsis and septic shock. So treatment options for sepsis relies basically on quick recognition. As we said, time is of essence. Every 1 hour delay of treatment, including antibiotic, will increase the risk of death by 4 to 8%. So the treatment would be to resuscitate the patient with fluids, track the lactic acid, make sure that you repeat the lactic acid regularly to bring the level to normal. Early initiation of antibiotic based on the most common or mostly suspected site of infection, and also obtaining the appropriate diagnostic testing such as blood culture, lactic acid level, simple blood work, and appropriate imaging studies. Steps to prevent sepsis would be early recognition of infection and prompt treatment that will prevent irregular infection from developing into severe sepsis and septic shock. Also, in the community, everything that we can do to minimize the risk of infection would be highly effective. Washing hands is one of the most important and least estimated or least recognized measure of preventing infection. So washing hands on a regular basis, avoiding crowded spaces. If you know that there is a sick person, stay away from him. And keeping up to date with the immunization, whether flu shot, pneumonia vaccination, and COVID-19 immunization as well. So, word of caution for patients with chronic condition like diabetes, COPD, heart failure, cancer treatment. As we mentioned, those patients are at higher risk of sepsis and septic shock and higher risk of dying if they develop that condition. So higher level of vigilance and sooner report to their physician is extremely important. If you have one of those conditions and you were diagnosed with an infection, you should expect to get better within 1 or 2 days. Not getting better or slightly getting worse is not okay. This is a red flag. Please report your condition to your doctor.